This one, when you're foam rolling, we'll actually go from the hamstring through the calf, because after that, a lot of hamstrings try to tighten up. So on this one, I'll demonstrate from the hamstring down. What I do is I just sit right on the glute, and, well, I might as well throw in a glute sequence. Okay, we're gonna do a larger sequence on this. So you right on the glute, and then you turn a little bit to the side to get on the actual meat. Obviously, you don't want to be on the bone. You might feel the sciatic nerve or the piriformis in there. If you hit a nerve, don't stay on it. Just move off of it. And then once you get on, there we go. You can feel an area that needs to be stretched. It'll talk to you. Bring this leg up here as a secondary if you're able to do so. I personally like to be on my elbow. It's more supported than the wrist to the shoulder. And then advanced, you grab this knee and pull it towards your shoulder. Woof. Who wants to foam roll along? We're gonna do it. We got a few of them here. Go ahead and start, Donna. You want? Oh, you have a half. All right. So now from there, you've gotten a good glute stretch. Then you straighten the leg and get just past the sits bone, the bone you sit on, and then you get the hamstring attachments. One thing to get the hamstring attachments, if you're hunched forward, it's not gonna work. You have to arch up like so. It'll talk to you. You have to just be barely below that bone. You can even, I just felt the sciatic nerve right there. Make sure you don't stay on that too long. And then arch, keep the chest high, you roll all the way down. Turn the leg, you can get the different hamstrings, because there's different areas. And then, the problem with foam rolling the calves is you need a lot of upper body strength to do the roll. And I find that my upper body gets tired a lot of times before I get the stretch. But anyway, here it is. Calf on the foam roller. I take my other leg, put the weight of the other leg on top, and advanced, use the toe to pull your calf back. And roll it. If I'm making faces, it's because this black foam roller is higher density and it hurts more. Oh, okay. Good times. And you've seen the sign that says it will hurt, and it can. Have you ever done the quad foam rolling? It's moderately excruciating. So be ready for it. It's face down. You just do it like a plank, but you have your leg on here. The other one's not on the foam roller. You can't have them, if it really hurts terribly, you can keep the other leg a little bit on the foam roller to ease the pain, but you go all the way to the knee and then all the way to the quad, attaches to the hip. Oh, hello. And it's also, yeah, it's also like a plank. You ever done planks for the core? So it also involves a plank and a foam roll. So the benefit of the roller, what it does is, you know, adhesions, they go in 3 dimensions. They go, they have a top and bottom thickness as well. And the foam roller essentially smashes that down and rolls it out. So it takes the fibers from being in disarray and arranges them into a flatter structure. And then when you do your regular stretching, they're already in a flat structure ready to be stretched. And your circulation in that area also improves, because when it's knotted up, your circulation creates an inflammatory response. So it partially short circuits that inflammatory response as well. So then it works better. Neurologically, your brain wants to use that muscle, because if it's inflamed and painful and scar tissue stuck, your body tells you, ow, use the other part of the muscle. Don't use that. You know, so you get more contractility and power and performance out of the area as well. So there's many reasons. Somebody would say, you know, foam roller could smash it too much and it's not the best to do. You know, active release is way better than that. Of course, but you can't do active release at home in an awkward area on yourself.